Understanding who is at high risk of developing tuberculosis. This is John. John has recently been sick with tuberculosis, or TB, and just completed a 6-month treatment. John hasn't seen his parents for over a year. Today, they've come for a visit. They're happy John has fully recovered, but are concerned because his daughter Pam had LTBI. What is LTBI? They want to learn more about it. John explains, latent tuberculosis infection, or LTBI, is the dormant form of TB, meaning Pam had been infected with the TB bacteria, but her immune system fought against the evolution of the disease. She had no symptoms and was not contagious. About 1/4 of the world's population has latent TB. Without treatment, people infected with TB bacteria have a 5 to 10% risk of developing active TB in their lifetime, with the majority within the first 2 to 3 years after the initial infection. The risk of developing TB is mainly linked to exposure and the quality of the immune system. There are 2 risk factors: recent contact with a person sick with TB and weakened immunity. At higher risk are those recently infected, such as close contacts of a person with infectious TB, or people working or residing in facilities or institutions where another person has active TB, such as hospitals, prisons, and homeless shelters. Those with medical conditions that weaken the immune system are also at greater risk, such as persons infected with HIV, people on medications that purposely weaken the immune system to treat another disease, or to prevent rejection after an organ transplant, to name only a few. Among all groups, persons living with HIV have the highest risk of developing active TB after having been infected. It is estimated that the risk is 80 to 110 times greater than in persons who are not infected with HIV. Young children are also at particular risk of developing the disease, as their immune system might not yet be fit enough to fight the bacteria. Not only can they develop the disease may be more extensive and severe. This is why Pam was treated for latent TB as soon as John fell ill. John's parents are amazed by their knowledge about LTBI, but they're still worried that Pam might develop the disease. John can reassure them. Pam was on medication that killed the TB bacteria. They can all rest easy, safe in the knowledge TB is treatable and preventable. If you think you belong to a high-risk group, don't wait. See your doctor today.